Hey guys, this is Jen Hersh with Crossroads Chiropractic and Wellness. I'm actually the corrective exercise specialist here. And I wanted to make a video about a big question that's been coming up this week from clients. And that is, what are some additional stretches or what's a set of stretches that can actually help with period pain? Kind of depending on how your body was formed or kind of depending on essentially muscle imbalances in your system, some people can actually feel quite a bit of period pain or even back cramping during that time of the month. And a lot of that has to do with the way the pelvic floor works, the way the QL muscle works, the way the psoas works. So here are some specific stretches that I do very gently and coach people through when experiencing a lot of back-focused cramping and period pain. Now, one of the reasons that happens is because this kind of jerk of a muscle called the QL. We appreciate that our body does all these things to take care of us, but that muscle can just tend to be overworked, a lot of times even because of some upper back and mid back tightness, and just because our psoas and QLs are so busy stabilizing us during our very tending to be sedentary lifestyle. So finding a place on the floor, any of the stretches that I show today, or in general with videos, please keep in mind that I'm hypermobile. But also please keep in mind that range of motion is going to be different per individual. So always go in and out of these stretches slowly. Go in and out of these stretches, I would say, with respect. Anytime we're dealing with that low back tightness, especially with the QL muscle, it can get kind of spicy in multiple directions. And so don't feel like you can just yoink out of these stretches. We want to really respect that range of motion. So what I'll do is I'll kind of prop my knee here in front of me. This elbow and arm can go whichever direction or how far down you feel comfortable. The thing that makes this stretch most effective is actually the way you breathe while you're doing these stretches. So if I put my hand or elbow down like so it can look like this, it can look like this, kind of wherever it is, right? So for me, I don't really get that stretch until I'm down here. Now, what we want to do is we want to bring that chest up. So even if I'm here and I want to bring that chest up, now I'm fairly, parallel with this leg. I'm going to come up and over. And I'm going to take a big deep breath in. Now, when I do that, I'm kind of breathing into this side muscle in order to get a better stretch. Now, when I go to come out of this, I'm going to gently guide myself out of this with both hands, kind of making this pushing motion, or whatever feels most comfortable. I don't want to rely on that muscle to pull me back out of this because we've just done such a beautiful job of stretching it. Now, from here, we could go a couple of different directions. You could go ahead and stretch the other side if you wanted, but I like turning everything into a flow. So what I'm personally going to do is now I'm going to turn, have both of these legs forward, and I'm going to add a little bit of a hamstring, kind of a nerve glide to this as well, just in case some nerves are compressed due to all the extra pressure around that time of the month. So both feet are up like so. I'm going to flex one foot forward and then gently turn away from that foot. And I'm going to come back and gently turn away. You can use this arm as a guide. You can use this arm as a guide. But really the point is to start low and kind of work your way into it. You can even inhale as you go to kind of protect your spine through rotation. But maybe try to actually finish breathing before you talk again. And that's a great way to take some pressure off of those muscle groups. Then I can easily kind of go into this flow and do the other side, right? Well, let's say I've done the other side. I can come back to center now, and I can even do some of these like gentle hip opening stretches just to take some pressure off. Now, once again, range of motion is going to vary according to the individual. So it's just kind of these like gentle walkouts, gentle walk back, get some dynamic movement through those hips. Now, a great activation for this is to add a little bit of a core and a glute, basically activation as you come back. So if I walk it out to here, I'm going to keep a neutral pelvis, and I'm going to gently squeeze glute and core. Core, it's a little easier with an exhale to bring myself back. It's kind of like when those toddlers like scoot on the floor. It's kind of that same concept, right? So walking it out, nice flat back, nice neutral core. Squeezing glute and core to bring you back. This is a great low core activation. This is a great glute activation because if we've gone to all this work to stretch this tissue, we want to make sure to activate the opposite side of it so that you get additional stabilization in addition to symptom release. Now, the next one's going to feel a little silly and might actually be very painful for some individuals. So once again, go into this lightly. We also want to wake up your adductors, right? And you can get a little bit of that here. But if you feel like you need some more, What we want to do is we want to move into a Frogger stretch that has some activation to it. Sometimes if you've never done this before, it can be a little triggering. So once again, kind of respect the motion. So I'm going to go into a position here where my feet are out, right? And on my forearms, I'm going to very gently get in a position where I feel like I kind of hug the floor with my knees. Yes, this is really fun to put on YouTube, right? And I'm going to squeeze the floor with my knees. I'm going to tuck tail up as I go back and tuck tail under as I go back, as I go forward. This forward and then backward motion is going through and waking up adductors very gently. Now, as you saw in that video, I don't have a lot of range of motion in that particular motion, right? And some people may. But what I'm doing is I'm telling the internal part of the hip, like, hey, as our tail is tucking and coming back and forward, we want to make sure that you guys are supporting. So I hope this takes some pressure off for you guys. If nothing else, it's just great to get some additional low back tightness gone or get some additional hip mobility going. If you have any questions, feel free to follow us, shout us out on social media, and you can always call an office or reach out if you feel like you need additional support to this. Also, let's figure out how many more times I can say additional in a video. Just kidding. Thank you guys.